This is what patient drop-off actually is. You've got two physios, same patient, and they have the same plan on paper. One retained her for 8 sessions and got her back running pain-free, and the other lost her after session 1. And I know this because it was the same patient. She left the first physio after session 1, and then she come back 6 months later with exactly the same problem, saw a different physio in the same clinic, and this time she stuck with the plan. It was the same diagnosis as previous, it was the same treatment plan, it was the same price, same clinic. That begs the question, what was the difference? Well, the first did what most physios do. Took a decent history, did a thorough assessment, found the problem, and explained it using the right anatomical terms. Then they did some treatment, gave her some exercises, and booked her in for the following week, but she cancelled 2 days later. When she come back 6 months later, the second physio did something different at the end of the session. He sat down, he confirmed the problem back to the patient in plain English, described her pain in a way that matched exactly what she'd been feeling for months. And then he did something really, really important, is that he made the link. He made it really clear and really obvious as to why the pain was showing up when it did, why it got worse when she ran on hills, and why it flared at the end of longer runs, and the patient then had this light bulb moment. Then he sold the why, not with scare tactics, but just honestly laid out what would happen if they didn't sort the underlying issue. He simply explained that she would stay in this cycle of flare, rest, and that the likelihood of developing more issues off the back of it would increase. And then when it come to establishing the plan, he kept the next step small. Really simple, 3 sessions, 1 week apart. Let's review your symptoms. He didn't overwhelm her with a 12-week plan on day 1, talk about all these different rehab exercises he's going to do, that we might have to inject it. It was just simple. 3 sessions, 1 week apart, review your progress. And that was it. And that was the difference. They had the same clinical skills. They both had the same plan, but they both got completely different outcomes. And it was all because one physio treated the injury and the other one actually communicated with her what was going on, why it was happening, and what the plan was. The first time round, she didn't know why she was coming back. The second time round, she did. This is what patient drop-off actually is. It's not a clinical failure, it's not a pricing problem, and it's not a patient problem. It's a communication gap that exists in session 1, and if you or a member of your team is noticing patients dropping off after the first session, it'd be worth sitting in and just having a look at how the therapist is communicating and articulating the plan to the patient.